Discover the emotion of victory in motion. Home of knee repair, not knee replacement.
So vitamin D is obviously, we're talking about bone, right? So what vitamins are good for your knee pain? Vitamin D is good for bone in general. So, I mean, having enough, and people, especially in the Northeast, and are low on vitamin D a lot of times. So get to your doctor, figure out what your vitamin D level is, and get your vitamin D to where it needs to be. There's a lot of other health benefits from having the right vitamin D. But don't just start pounding vitamin D on your own, because it's a fat soluble vitamin and it can build up in your system and can become toxic if you take too much. So get in with your primary care, get your vitamin D level checked, and get a recommendation as to how much vitamin D you should be taking per day. A little bit of sunlight can help as well. But you don't want to be, getting sunburned and all that type of stuff. But you'd be surprised how little sunlight you need per day to get to have your body generate and make enough vitamin D. Problem is, a lot of people don't get that, especially during the winter time. Vitamin C is very good for building collagen. We talked about collagen. Vitamin C also has a lot of other beneficial effects, just like vitamin D does as well, immune, etc. Vitamin E is not necessarily going to build cartilage or necessarily cure arthritis, but vitamin E is an anti-inflammatory. It's also fat soluble. So you want to talk to your doctor or your healthcare provider, what will be the right dose for you, or maybe even your pharmacist. But a certain level of vitamin E is good for anti-inflammatory. And so that would be helpful as well. I mean, fish oil is also anti-inflammatory, which has that type of stuff in it. It's kind of similar to vitamin E. So, I mean, I guess C, D, and E are probably the quote unquote best for arthritis. But if you do one of our genetic nutrition programs, you do get Kelly, who is a nutritionist, or one of her team, for 3 months, and they can easily go over that with you. And based on your genetics, also tell you, you might not need a ton of vitamin D compared to somebody else. There's certain things in your genetics which helps with that. And I know in my case, they went through all my vitamins and all that stuff as well. So that's why I almost hesitate to give people blanket recommendations when we can actually figure it out through their genetics and give them the exact recommendations.